Now, please join me in welcoming Dr. Leslie Waltke and Erica Vitek. Dr.
Thank
Waltke is
you,
a...
Jerry. Oh, I'm sorry.
Oh,
Okay, keep going. I
oh, I
didn't mean to
was
interrupt
actually
you.
going to give you the your
Okay,
two.
yeah, go. Go, Jeremy, go.
Dr. Waltke is a physical therapist with a clinical mastery in cancer rehabilitation. She has been the cancer rehabilitation. She leads the Waltke Institute for Cancer Rehabilitation. As well, Erica Vitek is an occupational therapist working in hospital-based outpatient rehabilitation at Aurora Sinai Medical Center and specializes in male, female, and pediatric evaluation and treatment of the pelvic floor and related bladder, bowel, and sexual health issues. So thank you so much to both of you for joining us today. It's my pleasure to hand it over to you.
All right, Jeremy, thank you so much. And thank you so much, ZERO Prostate, for welcoming us today. And welcome everyone for being here. I always say that I hate that cancer brought us together, but it's a pleasure to meet you and talk with you today. So we are talking about side effects today, and they are a plethora, and they are profound. So just from surgery and radiation alone, common side effects for people being treated for prostate cancer include pain, weakness, skin changes, scarring, swelling, and risk for lymphedema in the legs and the genital area, loss of function, incontinence, changes in sexual health. And then from chemo and hormone therapy, you may run into side effects such as fatigue, weakness, nausea, muscle loss, bone loss, difficulty walking, neuropathy, weight gain, weight loss, risk for heart disease, mood changes, hot flashes, balance problems. So these are common side effects, but this doesn't hit the entire list. And though we don't have time to talk about all of them today or cover them all today, I do want to make sure that you realize that cancer is awful, treatment is brutal, and recovery often is very difficult and under-addressed in many. Survivorship, as you know, can be incredibly under-addressed. So I really encourage you, if you are struggling with any of these side effects, yes, they're typical, but that doesn't mean they're common. It doesn't mean that we can't make them better. So please, I encourage you to reach out to your nurse practitioner, your nurse navigator, your physician, your nurse practitioner to help you find a rehab therapist that can help you with any or all of these problems that you are dealing with. It is never too late to get help and to get better. With rehab, first of all, it is, again, people just think because they have cancer, they're supposed to be miserable. You deserve to feel strong. You deserve to be healthy. You deserve to be pain-free. And you definitely deserve to have your bladder and sexual health concerns both addressed and treated. So again, you deserve to have a rehab therapist help you with the problems that you have, and then also help you build an exercise prescription based specifically for you. And that is because the data on exercise is incredibly clear and incredibly robust. Cancer hates exercise. Research has definitively shown that for people with prostate cancer, exercise will decrease many of the side effects, minimize many of the side effects, or eliminate many of the side effects. And most importantly, exercise for people with a history of prostate cancer decreases the risk of recurrence and decreases the risk of dying from prostate cancer. So there is zero reason why everybody with a word cancer survivor behind their name should not be exercising regularly. But that's difficult when you've been through living hell. So again, find a physical therapist that can help you with this. So just to splash it out really quickly, during treatment, people should be exercising about 90 minutes a week. And that includes both aerobic exercise, which is walking, bicycling, swimming, whatever feels good to you, and muscle strengthening exercises. After treatment, we want you to hit about 2.5 hours to 5 hours a week of exercise. Again, both combined of aerobic and resistive exercise. So we want you doing something aerobically 5 to 6 days a week, and you should be strengthening your muscles 2 to 3 days per week. And this is the main prescription that's generalized to everybody that will certainly help reduce the risk and the impact of many of those side effects on your body, and then give you that protection against cancer recurrence. So again, seek out a physical therapist to help you to develop a specific plan specifically for you, your body type, who you are, what you have access to. All right, so now it is my absolute pleasure to introduce my colleague and pelvic floor expert, Erica Vitek, who is an occupational therapist. Erica, welcome.
Thank you, Leslie. I'm excited to be here.
All right, so my first question is, what the heck? Hang on a second. What the heck is a pelvic floor? I mean, if you're human, you've got one, but it's something we never get taught about in school, ever. I mean, never. So tell us, what is it?
Exactly. So it is the group of muscles that literally is the floor of the pelvis, hence pelvic floor. So easy to remember. The base of your pelvis, it supports all the organs, bladder, bowel, and sexual health organs, and including, it even supports the prostate when the prostate is still present, depending on what type of treatment you have. It helps really control the ability of blood flow to come in, blood flow to go out, and it controls our continence, meaning that we don't leak when we're not supposed to.
Okay, so a little bit of a trigger alert. This next slide is going to have anatomical pictures of the pelvic floor and male pelvic floor and genitalia. So, Erica, could you just walk us through really quick? Now we have actually a picture of the pelvis and the pelvic floor. So give us a quick walkthrough here.
So on the left-hand side of your screen, that's a side view of a male pelvis. And we can see the muscles are in red on the bottom that are coming out of the pelvis. So what we can see coming out of the pelvis is actually the anal muscle in the back area. And that's the opening for bowel movements. And then it leads into the penile region where the testicles are and the penis is. The pelvic floor muscles cover that entire area. So the same muscle that controls the bowel habits, bowel control, being able to go easily, is the same exact muscle that's going to help control the bladder. When we're looking at the side of the screen, we see the pelvis from the bottom. So the penis hanging down. This is like if somebody's were laying on their stomach, penis is hanging down. And then you see the pelvic floor is kind of like a hammock shape. It connects from the tailbone all the way to the pubic bone and surrounds the penis and anal opening for bowel movements. So it's a really nice picture of how that is supportive and is that floor that we're speaking of the pelvis.
Okay. Fabulous. All right. So let's talk about bladder health first. And before we talk about things that go wrong after treatment, what's normal?
Yes. So a lot of people ask that, like, how many times should I eat today, right? And should I be going every night? And that can vary depending on what you intake. But in general, you should go about 6 to 8 times a day, every 2 to 3 hours. Sometimes people go a little longer if you haven't drank anything. And then 0 to 1 times a night. So some people get up at night and some people don't. Now, when you start going more like 2 or 3 times a night, 4 times a night, that can be so disruptive. So those are things to keep in mind as to what's normal. Full bladder is what really signals us to like have to go, the gotta go feeling. Our bladder fills slowly throughout the day with what we're drinking. And then it gives us the signal of sensation that the bladder is full and then we have to go to the bathroom. But our strong pelvic floor, when we exercise this pelvic floor and have strength there, it prevents us from leaking on our way there. We can support it so that we can say, take a trip and wait until the plane lands, or we can stand in line. Guys don't have to stand in line. Who are we kidding, right? And that we really should be able to empty our bladder when we go without any straining, pushing, or a lot of effort. It should be kind of just relax and it all comes out on its own.
Okay. All right. So now when we talk about incontinence, we generally understand that is leaking urine when we don't want to or don't plan to. But there's different types of incontinence. Can you tell us about what those things are?
Yes, definitely. So incontinence is not normal in any way, okay? Before surgery, after surgery, before treatment, after treatment, any of these things. So we want to treat it because we can do something about this. So what we call stress incontinence or stress leakage is if you cough, laugh, or sneeze, and a little bit of urine comes out. And that's because we have a little bit of abdominal or belly pressure that goes onto your bladder to push it out, okay? That's called stress incontinence. Urge incontinence is when you get the gotta go feeling and you're trying to get to the bathroom and it's coming out before you even get there. Overflow would be like, say, for example, you have an enlarged prostate and it's blocking the urethra or the tube that exits the bladder. And then that causes the bladder not to empty fully. So that's a big deal. And then what happens is we get kind of this overflow where the bladder has to let some urine out because you're not emptying fully. So that's an important one to know about as well. And then mixed incontinence is typically referred to when you have a stress incontinence, like leak when you cough, leak when you sneeze, and an urge incontinence. You have both of those. They call that mixed incontinence.
Okay. All right. So if somebody is dealing with this and then starts, treatment for incontinence with their physician and with their OT or their PT, what is expected? What can get better? What are the goals?
Absolutely. So we can significantly reduce and in many cases eliminate urinary leakage, which is huge because it's a big burden.
Yeah.
Largest burdens that come sometimes with cancer treatment of the prostate. And it's frustrating because it affects your work, it affects your relationships, it affects your day-to-day. So it can be very important and we can help that. We want to improve the pelvic floor muscle strength. We want to be really coordinated with that muscle in order to stop urine from leaking out. And we work on that during our therapy together. And we can reestablish those normal bladder habits we just talked about. So we're trying to go from what do things look like right now back to those normal habits. And there's lots of techniques in therapy we use to get to that point to then restore your confidence and get your quality of life back on track.
Okay. So key points is incontinence is never normal, even if you've had prostate radiation or surgery, and then it is helpable and improvable with rehab. Fabulous. Okay. So we've talked about exercise a little bit just for general bone strength, health strength, muscle strength, heart and lung strength. But what about pelvic floor strength? What are some exercises people would do if they came to see a rehab therapist?
Absolutely. So pelvic floor strengthening consists of what you might hear in your readings is called Kegels or just pelvic floor exercise. Kegels was the gentleman who came up with these exercises back in the earlier 1900s. And so that is how those got named. But basically what we do is we progressively strengthen you as Leslie would do in her exercise therapy for other muscles. So you work on strengthening the pelvic floor with different strategies of squeezing and relaxing at different lengths of time, different maximal pressures of squeezing. And then we start to incorporate functional movement. So a lot of guys will say, I leak when I get out of the chair or I get out of bed or I'm trying to get out of the car or I'm trying to lift something. So we can actually work on using your breath control and using functional movement type exercise, stabilizing the core muscles, and the pelvic floor is part of our core, and trying to get that all stabilized in order to control for urinary leakage. So those are all the functional things we can work on. We also work on controlling urges. So sometimes if the prostate is removed or you're having some treatment of the prostate, urges might become a little more strong than they were before. And so we may need to use distraction type techniques. We may need to use the pelvic floor in different ways to try to slow down those urges and let the body, the bladder, accommodate for more volume, because we're trying to get more volume in that bladder before you have to go so you can live and not have to run to the bathroom all the time. And then freeze, meaning try not to rush to the bathroom or run to the bathroom when you get that real strong urge. You can stay still, use your pelvic floor muscle to squeeze to try to calm it down, then walk to the bathroom. Success is greatly improved in that scenario.
Fantastic. Okay, so that's some exercise stuff. Now, what about lifestyle changes, behavior changes? What can a guy individually do to help the pelvic floor and incontinence and sexual health?
Yeah, so you can have a strong pelvic floor, but if you're not drinking enough water, if you're drinking diet soda or regular soda or caffeinated, carbonated type beverages all day long, coffee, those things are going to aggravate your bladder. I'm not saying you can't drink them. However, you might want to live near the bathroom if you are, because it can enhance your urgency. So if you want to try to get that bladder back on track, it's actually best to eliminate these irritants of caffeine, carbonation, coffees, teas that have caffeine, spicy related things, alcohol that can dehydrate you. You want to drink water if you can for a while. Let your body heal a bit and let's kind of see where we can get with that. They usually say 6 to 8 glasses a day. There's also some that say, half your body weight in ounces in a day. But we really have to kind of find that right amount for you. And so that can be different for everyone. And you also don't want to get constipated. Constipation can make all these bladder incontinence issues worse. And so eating a fiber-rich diet, healthy fibers, with water, because water helps fiber work better, that will help with your bladder as well. So a lot of people don't think about the bowels. It's very important that you have a bowel movement about daily. That would be the best. It's still normal to only have a bowel movement about 3 times a week. However, way better for your bladder if we can shoot for kind of a daily. Additionally, the very last point I'd like to make is that smoking or nicotine in general is a bladder irritant. It's actually very, very high on the list as far as causing bladder cancers. I know we're talking about prostate today, but very important to think about if you are addicted to nicotine, that actually, if you got some help with that could also make your life a little easier.
Okay. All right. I'm going to jump us ahead a couple of slides. And let's talk about sexual health recovery after prostate cancer treatment. Can you just begin by telling us about the 3 types of erection and then how that's all impacted and talk about sexual health recovery?
Absolutely. So there are 3 types of erection, as Leslie said. So the first type is a nocturnal erection. So that would be when you're asleep, the body has this ability to refresh and kind of renew the tissues. And so men will have, in a healthy male, about 4 to 5, maybe refresh erections a night. That helps to just kind of get those tissues that good blood flow, get that good erection, and then flushes that out. It kind of just is a cleaning out of the area. So that's the first one. The second one is a psychogenic type of erection. So a psychogenic erection is when a man thinks about a pleasurable thing that is of interest to them, that makes them feel good about their sexual health, or they are attracted to somebody. That is what creates the thinking about sexual activity and allows for some erectile function. However, the most strong erection is called a reflexive erection, and that is when there is physical touch to the penile tissue. So when the penile tissue is actually stimulated, they call it reflexive because it works with our spinal cord, so it's a little complicated as far as the neurologic and the physical basis of it. But it's called reflexive because when somebody or something touches that area, it is arousing, and then it causes more blood flow, and we get the erection from that. And so the average male has their best erection when they have the psychogenic, so they are thinking about being aroused, and the reflexive combined. What's really also important is that after prostate surgery, it can be really encouraging to hear that a male is having nocturnal erections, because that might be the first sign of some recovery of those erectile tissues. So that is a really important thing, as just a note to pay attention to.
All right. So if somebody's having issues with their sexual health, erectile dysfunction, what can they do to seek out an occupational therapist? And again, what can you do in pelvic floor therapy to help?
Yes, absolutely. So we want to think about this as really a combination approach. You know, in therapy, we really look at the whole person. We're not just looking at only, right? We're looking at your physical health. So all the general exercise is, of course, very important. Your blood pressure, your mental health, your strength of your pelvic floor. So this is a key piece as well. If you do not have a strong pelvic floor, when blood flows into that region, it's very hard for the body to maintain the erection, because we need strong pelvic muscles to maintain the blood flow into the penis for an erection. Super helpful. Now, medications is kind of a secondary piece, which can be really helpful, but it's doctor directed. So Leslie and I do not prescribe these medications. However, we could maybe discuss it with the physician if needed, or maybe someone already comes to us and they're on that already. And that can then boost the person's ability as well to have erectile function. So a PDE5 inhibitor helps more blood flow. And then, as I was saying, the pelvic floor strength helps keep that blood flow there. So really important. Now, there's a lot of different assistive kind of devices that are out there. Pumps, penile pumps for post-surgery. So that brings more blood flow in. That can also then be facilitated by a ring at the penis base to keep that blood flow in there, that you wear temporarily. This is not something you wear for long periods. Most say like 30 minutes, keeping that ring on. And then there's also vibration tools. So remember how I mentioned reflexive erection. Vibration can enhance that reflex response of the body to actually have an erection. And if you are aroused already because you have the thought, or you're with your partner, that can be super helpful to enhance a reflexive erection. So these are all things we do in our therapy. Find the right.
All right. So fantastic. So again, moral of this story is erectile dysfunction, bladder incontinence after surgery, radiation, chemotherapy, hormonal therapies is common, but doesn't have to be normal, and it can be improved. It can be eliminated, and certainly helped significantly. So again, if you are living with this stuff, make sure you seek out help. So as we wrap up, I, again, just want to remind you that your first next steps, like, well, what do I do next? First of all, get into your psyche that you deserve to feel well and function well. It's not like, oh, that's an extra bonus. You deserve that. It's part of your cancer team is to put you back to normal after we've destroyed the cancer. So please, your next step would then begin to talk to your medical team about getting a good rehab therapist or therapists. Sometimes it takes more than one on a team. And again, seek out someone that can help you with regular exercise. So I am happy now to take questions.
Yeah, thank you so much for that great presentation. Really appreciate it. And we will go to some questions. And so you talked about pelvic floor therapy, and I think it's really important to talk about when it can help. Now, is it just recommended post surgery or treatment if it's even radiation, or is it recommended or should it be considered prior to beginning definitive treatment?
I think the trend, Jeremy, right now is that our urologists are sending patients to me for instruction if they're having their prostate removed. I wouldn't say I regularly see people pre-radiation. However, if they're having symptoms already, some urologists are very proactive and have already sent their person to see me for pelvic rehab. But I would say that the general trend is prehab or pre-rehabilitation before a prostate removal, so we can get down how to do the exercises. And we have that solid for after the catheter is removed, and we can get started right after surgery. Typically, I'll see someone around the 4 to 6 week mark post-surgery. And that's also dependent on urology, but that's about typical.
Yeah, I would just add that I don't wait for your physician to bring it up. Usually they're pretty good, but if they do not wait. You can bring it up on the first visit, even if they say you wait until here. Bring it up if you haven't heard the words.
Yeah, no, I like that. Thank you. That's always helpful. It's a good question, and that's kind of what we call prehab. Is that correct in your lingo to get that even start before treatment?
Yeah.
Okay. Now, is this something that is done typically in a physician's office or a physical therapy location, and then do you give them tools that they can then take home to do these exercises?
Yeah, typically my therapy in pelvic rehab is conducted in a rehabilitation facility or an outpatient center. I happen to be at a hospital outpatient center. However, I have many colleagues throughout my health system that work in clinics and things like that. I think that it's more rare to have people in a doctor's office. However, it's not unheard of, and it is becoming more of a collaborative approach. So I think that probably other places do offer that. And then we have all the equipment here that we might need. So we have ways to monitor the muscles electronically, where we can actually visualize the muscles on something called biofeedback. We can also visualize the muscles on ultrasound. So those are very helpful tools to teach men how to use their muscles if they don't understand how to find it or use it. And then that helps them get stronger much faster because they get some objective information right there. And then you got it, Jeremy, home program, lots of home program.
Okay. And then I think we'll do one last question. How soon, if you can answer this, how soon after SBRT radiation therapy can sexual activity generally start? Do you have an idea about that? What might be good?
I think that really varies by person. A lot of it depends on, and what I see from urology is they do a lot of assessment to see what is erectile function pre. And they also, some physicians that I work with will start patients on Cialis, Viagra, those kind of medications during recovery and treatment to kind of enhance blood flow and healing. But I do think that does vary somewhat. A lot of physicians will kind of go by this 2-year rule of we have some time for nerve regeneration within that time. That's like prime healing time and a really great time for rehab. But that doesn't mean it takes 2 years for everyone. It could, but be hopeful for people who haven't recovered it right away that there's still time and we can continue to work. And even beyond that, I work with many people even beyond that.
Okay, that's great. Well, thank you so much.